Mr. Secretary, we turn it over to you for your opening statement.
Chairman Crapo, thank you. Ranking Member Wyden and members of the committee, thank you for the opportunity to appear before you today to discuss President Trump's proposed 2027 budget for HHS. First, I'd like to take a moment to express my deepest condolences to your colleague, Senator Mark Warner, over the recent loss of his daughter, Madison. My thoughts and prayers with him and his family. We stand at a generational turning point. Our children are the sickest generation in modern history, and decades of failed policies, captured agencies, and profit-driven systems caused it. Parents across this country demanded change, and we are delivering it. We're ending the era of federal policies that fueled the chronic disease epidemic and replacing them with policies that put the health of the American people first. President Trump and I are challenging the status quo and the institutions that defended as we work to make America healthy again. In just 15 months, HHS has delivered historic wins. We negotiated the most favored nation drug prices with 16 of the largest pharmaceutical companies so that Americans no longer pay more than other people in wealthy countries for the exact same medications. We're bringing real transparency to healthcare pricing so that patients know the cost of care before they receive it. I use the full convening power of the federal government to bring health insurance CEOs to the table to reform prior authorization, and I brought the 400 largest tech companies together to end information blocking so that for the first time Americans will be able to get their own health records, which they own, on their cell phones. We are cutting red tape, speeding decisions, and demanding transparency. We're also cracking down on waste, fraud, and abuse. This year, HHS and USDA issued new dietary guidelines that put real whole food at the center of the American plate. We flipped the food pyramid upside down and sent a clear message to the American people: eat real food. HHS has opened the door to partnerships with industry, trade associations, nonprofits, and advocacy groups. More than 50 medical schools have committed to expand nutrition education from an average of 2 hours to 40 hours. Food manufacturers are stepping up too. More than 40% of the food industry has committed to phase out petroleum-based dyes by the end of the year, and many have already eliminated them. In conjunction with these efforts, FDA approved 6 natural food colorings derived from fruits and vegetables. Through President Trump's Great American Recovery Initiative, HHS is matching compassion with action to help Americans break the cycle of addiction. At HHS, we are prioritizing patients with ultra-rare diseases and their families, driving faster access to life-saving treatments. We're restoring gold standard science and integrity across the agency. We're protecting children from sex-rejecting procedures that expose them to irreversible harms. We're eliminating outdated and misleading warning labels on hormone therapies used by women during menopause. We're strengthening oversight of organ procurement. We are regulating television advertisements for pharmaceutical industries, something the Democrats have been asking for generations. We're implementing Operation Stork Speed to ensure the safety and quality of infant formula. We're applying that same focus and urgency to rural America. The Rural Health Transformation Fund delivers the largest investment in rural health in our nation's history, $50 billion over 5 years, to strengthen rural hospitals and ensure Americans can access the care they need no matter where they live. HHS has also last week announced more than $135 million investment this month to expand rural residency programs and nutrition services. The data is clear: when physicians train in rural communities, they're far more likely to stay and serve there. The president's budget puts all these priorities in action. It invests in prevention because preventing disease costs less than treating it. As my uncle, President John F. Kennedy, said, progress is a nice word. Change is its motivator, and change has its enemies. We see those forces clearly: entrenched interests, defenders of a failing status quo, and institutions that put profits ahead of the American people. The resistance underscores the urgency of this moment. We can reverse chronic disease, improve public health, and lower costs. I stand ready to work with this committee and Congress to seize this opportunity, to implement and codify lasting generational reform in American healthcare for our country, for our children, and for the health of the American people. Together, we can make America healthy again. Thank you, Mr. Chairman.
Thank you, Mr. Secretary.
What you just heard is being framed as a generational reform, but let's slow this down and really unpack what's happening here, because when sweeping claims about transforming healthcare come this fast and this confidently, that's exactly when Americans need to lean in, not tune out. Robert F. Kennedy Jr. is stepping into Congress with a bold narrative that America is the sickest generation, that decades of policy failures created a chronic disease crisis, and that the solution is a dramatic overhaul driven by the current administration under Donald Trump. Now, on the surface, some of this language sounds appealing. Lower drug prices, more transparency, better nutrition, stronger rural health care. Those are goals Democrats have been fighting for years. But here's the critical difference. Policy isn't just about what you promise. It's about how you deliver it, who benefits, and what gets quietly reshaped underneath the surface. Take the claim about negotiating drug prices with pharmaceutical companies. Democrats, including leaders like Joe Biden, spent years pushing to give Medicare the power to negotiate lower drug prices, something that actually passed into law after decades of resistance. So when you hear this administration suddenly embracing similar language, the question isn't, is this good? It's, what's different? What's missing, and who's really in control of those negotiations? Then there's this heavy emphasis on partnerships with industry. That might sound collaborative, but historically, when government leans too heavily on industry to self-regulate, especially in healthcare and food, you often get the same profit-driven incentives that helped create the problem in the first place. You don't fix a system captured by corporate interests by handing more influence back to those same players and hoping for a different outcome.